This sharp thing that cannot even be explained by the CS herself. The CS is finding it so difficult to tell Kenyans what is in the SHA, what is Shif, and how are they going to work. So we are asking, if the CS who has all the resources and the experts around her cannot explain, how is Mama Mboga on the ground going to understand this SHA thing? How is the vijana kwa mashinani wataelewa hii maneno? Wazee pale mashinani watapataje hii maneno? So we are telling the government to focus on critical issues. It is very sad to note that health is a very critical matter in this country. But the government has managed to divert the focus of Kenyans from talking or from discussing issues like the SHA and Shif to reduce us to a political and individual issues and differences that they are having with the Deputy President of Kenya. Right now, as we're talking, the SHA has reduced the dialysis cost, which was initially stated by NHIF at 9,000 shillings, up to 2,300 shillings. Something that is very sad, and we have dialysis patients struggling and finding it very difficult to get their medications. Today as we talk, we have many patients with critical conditions who cannot manage to pay for their medications because of the transition we've had. Ladies and gentlemen, it is very sad to note that we are focusing on the issues of the UDA politics, whereas there's a looming scandal that is hiding and it has been drawn away from us. This sharp thing that cannot even be explained by the CS herself. The CS is finding it so difficult to tell Kenyans what is in the SHA, what is Shif, and how are they going to work. So we are asking, if the CS who has all the resources and the experts around her cannot explain, how is Mama Mboga on the ground going to understand this SHA thing? How is the vijana kwa mashinani wataelewa hii maneno? Wazee pale mashinani watapataje hii maneno? So we are telling the government to focus on critical issues. We cannot be discussing an individual matter. Talk of the Rigathi Gachagua impeachment, whereas Kenyans are dying, hospitals are full with patients who cannot manage. In fact, the registration process alone has proven to be so difficult, tedious, and time costing. So we are asking the question. The government is so much focused on rebranding the building to name it from NHIF to SHA, whereas the real service is not there. Unfortunately enough, the employees who are there at NHIF, all of them have been rendered, if not, but majority have been rendered jobless as we're talking right now. Yet we were told that there will be a smooth transition from NHIF to SHA. Today we are having employees being rendered jobless. Patients cannot get medication as it used to be. And we have people who had paid for the NHIF up to yesterday when they finally closed it. So we are asking the CS to come out clear and tell the country how this thing is going to work. And if she cannot explain it, okay, awachie watu wengine wafanye maneno, but I don't think it is necessary that we focus on things that are not necessary. It is very sad to note that the issues around the Rigathi Gachagua impeachment are coming at a time where we recently had the Adani scandal, we had the SHA scandal, we had the new funding model of university scandal. These are things that have now been put outside the public limelight so that we can focus on the impeachment of an individual. So as we focus on this as Kenyans, these scandals are going. I want to tell you Kenyans that there's a looming billion scandal, multi-billion scandal that's going to come out of this SHA. If we can reduce dialysis cost from 9,000 to 2,300, the difference, this money, where is it going to? And who is going to pay for it for the patients to be treated? And the CS in charge of health must come out and give proper clarification and understanding of what is SHA, what is Shif, and how is the transition going to take place. And she must assure us that the employees of NHIF will not lose their work or their jobs. She must assure us that the the same way NHIF paid for dialysis at 9,000, we will get that 2,300. And she must explain to us that the 2.7% that we are giving, how much is the value that we are going to get? Because we are not going to be in a situation where we pay over 3,000 Kenyan shillings and we get services of 200 shillings. Then there must be an explanation to where 2,800 shillings is the difference. So 2.75 We must get proper communication, proper clarification, and proper guidance on how it's going to be spent.